So welcome everyone to the Chronic Pain Network, the first of our series of the Patient Engagement in Research Rounds. So my name is Dawn Richards, and I've been working with the network, specifically with the Patient Engagement Committee and the patient engagement activities that have been happening within the network. A couple of things just as kind of housekeeping business so that everyone knows. We are recording the webinar today, so for people who aren't able to make it live, we will be recording and putting it online for future reference. The second thing is I see most of you are on mute, so thank you. We'd like to ask you, so that we can minimize background noise, if you could remain on mute for the webinar itself. Secondly, throughout the meeting, we would encourage you to type questions into the chat box that hopefully you'll see on your screen. It's generally on the lower right-hand side of your screen. If you could either send them to myself, so Dawn Richards, or send them to everyone as the webinar is happening, that would be great. We're going to ask all of our speakers to speak in succession, and then I'll kind of be the moderator for questions. And just to make things a little bit easier, I'll simply ask the questions that you've sent to me via chat so that we can try and get through as many as possible, and again, kind of minimize any issues we have with background noise, etc. So without further ado, I will advance the slides and start the webinar here. So just to give you a brief introduction, the network is calling this our Patient Engagement in Research Rounds. And this was an idea that we had within the Patient Engagement Committee. And we're really cognizant that we can learn lots about patient engagement in research from people outside of our network, but we also know that we have a lot of experience within our network already. And so the idea with our patient engagement and research rounds really is to harness and share the network's collective experiences in patient engagement, or PE, in research. And the name comes from hospital rounds, where the idea is to share firsthand experiences with others, to talk about lessons learned, seek advice from them, solicit feedback, and really stimulate further insights and grow as a community with respect to patient engagement. So our idea here is that as our network and our experiences grow, we'll continue to add to our collective knowledge of patient engagement and research via these webinars. So our goal is to probably host, at least for the next few months, about one webinar every 4 to 6 weeks. So honestly, if you would like to share your own experiences in patient engagement and research, please do let us know, and we can work with you if you're interested in sharing those experiences via webinar. Otherwise, we'll be actively soliciting from you. I know that some of you have been engaged, so we'd love for you to volunteer, but if you're not comfortable with that, I'll come in and talk to you maybe privately and see if that's something you're interested in. So I'd like to start off the webinar just by letting you know that today's topic is meaningful patient engagement in the context of pediatric pain research. So we've got 3 speakers with us today that really represent, I'll say, different points in the researcher journey. So we've got Dr. Jennifer Stinson with us. She'll be speaking first, and Jen is a nurse practitioner, and she conducts research in chronic pain in children, as well as using technology to help those individuals and their families better deal and manage with their pain. Secondly, we'll have Katie Birnie, and Katie is a postdoctoral fellow in Jen's lab, and she has a PhD in clinical psychology, and she'll be providing a specific example of a research project that's happening right now. And last but not least, we have Carley Ouellette, who's with us, And Carley is a registered nurse, and she herself is a person who lives with chronic pain. So she's going to give us kind of a bit of a dual perspective of her work on both sides of the fence here. So as I mentioned, we will proceed through the presentations first, but again, please do type in your questions in the chat box, either to everyone or just to me, and at the end of our session, we'll try and answer as many questions as we can during the webinar. And honestly, if we can't during the webinar, I think there are other ways that we can get back to you on your questions as well. So without further ado, I'll pass it off to Jen Stinson, and over to you, Jen.
Thanks, Dawn, for that warm welcome, and welcome everyone. I can see that there are a lot of patient partners on, as well as some clinicians and researchers, so that's great, and we really look forward to your questions at the end. Objectives of our session today are really to give a high-level overview of what we believe is meaningful patient engagement, and we're going to do this within the context of pediatric research, pain research, because that's the environment we work in. And we're going to do this by providing some examples. So I'm going to speak about an app that we've developed for young people with chronic pain and how we've engaged young people in the development and design of that. Katie is going to talk about a new project that we have funded from CIHR on a pediatric chronic pain patient engagement initiative. And then, as Dawn said, Carley is going to talk about her perspective in being involved in research, also from a student and a nurse as well as a patient. And then we're going to end with lessons learned. So just to get everyone on the same page, when we talk about patient-oriented research, it's really a continuum of research that engages patients as true partners, and it really should focus on issues that are identified by patients that are important, and that by doing so will lead to improved patient outcomes in terms of clinical care. And really, the landscape has changed at CIHR, which is the Canadian Institutes of Health Research, with a real focus on really encouraging researchers, almost mandating them now, to include patients as meaningful partners in research. So before, it used to be solely researchers that would be on grant applications, and now we are really moving, which I think is an excellent move, to include patients, care providers, whether that's patients or spouses involved as well as those people that are going to be making decisions within the health system about funding priorities. So what is patient engagement in patient-oriented research? And this has really been defined by the Patient Engagement Framework at CIHR as meaningful and collaborative, active collaboration in the governance, so the governance of your research project, or like the governance of the Canadian Pain Network, active involvement in setting the priorities for research. So what are the most important things that we as researchers should be focusing on? What are the most important things that funding agencies should be focusing on? We should be actively involving patients in a meaningful way in actually conducting our research. And I'm going to talk a little bit about explaining the research cycle and where along in that continuum that patients can be involved in. And I think patients are excellent at helping us translate the findings from our study back to their providers, to their friends, to policymakers, and it's usually their translation of the research back that can have the most impact. So Involved is an organization that's really involved in patient engagement, and their slogan is research being carried out with or by members of the public rather than to, about, and for them. And some guiding principles that have been developed for patient engagement in research are really four main ones. So inclusiveness, so patients are bringing their lives into this. And I was noticing on the patient engagement base camp this morning that someone had posted, and I think it was Mary, about that, you know, they're occasionally patients, but they're always a person. And I think it's really important to remember that. We have to create an environment when we're involving patients in all aspects of research that's safe, that's culturally competent. We have to provide people with training and education, and that's why I think these rounds are really important, because they can help educate patients, but also clinicians and researchers on how to meaningfully engage patients. I think obviously we have to have mutual respect, so this acknowledges that each of us bring expertise and experience, and that experiential knowledge that both the patients and clinicians and researcher have is evidence in and of itself and should be acknowledged. And that you'll see from the examples that we talk about that we really firmly believe in this co-building, so working together as partners from the beginning. And I think historically, and I even did this as a researcher, we brought patients in at the end to help with knowledge dissemination or whatever, but really they should begin when you identify what the idea is that you want to work on as a researcher, and help them craft what that is going to be, and actively and have them involved in the grant, analyzing the data, you know, to the best of their ability or what they want to be involved in. But I think co-building is really, really important rather than bringing people in at the end. So this framework from CIHR just talks about some of the principles again, and how if you involve knowledge users and they provide input on what should the health research priorities be, it helps us to focus research that's conducted in this area that's valuable to knowledge users. They help participate in the design and the undertaking of research projects. It helps researchers understand the value of involving patients as partners, and then we have the shared understanding of each person's value that they bring to that research project. And both of these things the knowledge users can really influence and help accelerate the decision-making, the translation and uptake of the new research. So I don't know if you guys know, but most research takes 17 years to get into practice, and that's way too long. And so I really believe that if we involve patients as partners and other healthcare policy decision makers, we can get these interventions translated into clinical practice much more sooner. And all of that will help improve the experience, the health outcomes, and create a more sustainable healthcare system. So this is the research process or life cycle that I mentioned before. And so the first most important thing to do is really identify and prioritize what are the most important things to focus on in terms of research. And prior to involving patients, I would do this by listening to patients and families, for example, in the clinic I work with, and seeing what problems they were struggling with. And it was always like access to care and psychological services and those types of things, which led me to sort of develop some novel applications or web-based applications to improve access. But Katie will talk about a project where we're involving patients to identify what's most important in the research related to treatment of chronic pain. You then go on and decide what is the best method to evaluate that. That could be a qualitative study where we do interviews with patients and their families, or it could be a randomized controlled trial where we're looking at whether one intervention is better than usual care or another intervention. We design a grant that we apply for in terms of getting funding to do that study. We then, after ethics approval, we carry out the study, we collect data, and it's really important to analyze it and interpret it. And again, dissemination is key. And then this whole, once we find out something's effective, we then have to figure out how to implement it in real practice, and then continue to monitor and evaluate it. So in each of these steps of the cycle, patients should be actively involved. They don't, and it'll depend on their comfort level and the training that they receive, how they want to be involved. They can be involved in some, or just in the study itself. And so it's important to figure out where your partners want to be in that. And Katie will talk about one strategy we're doing to develop something to help with that. So we're going to keep bringing back to this International Association for Public Participation, the IAP2, which really gets at this topic that I was talking about how patients want to be involved. So whether they just want to be informed about the research that's going on, whether they actually want to be consulted and obtain their feedback on what are the most important issues or decisions, whether they actually want to be actively involved in the research project, whether they actually want to collaborate on it, and then to the very end where actually some patients are actually designing their own research studies and being co-investigators with researchers on projects, and then there you'll get to decide what you implement, etc. So throughout the examples, we're going to try to keep coming back to this diagram. And also it's important to know that it's important for patients to realize that they can maybe agree initially that they want to be involved, and then things change within their life or et cetera, that they say that they need to drop out or come back in a few months. And so that's totally fine, and that should be supported. So now we'll get into the examples. So I'm going to start first with an example from our lab. So as Dawn mentioned, one of the focuses in my lab is to develop smartphone applications that can really help young people access services that are typically only available in tertiary care centers. So we've been funded to develop the I Can Cope app. So this is a platform, and we have funding for young people with chronic pain 15 to 25 years. We've developed a version for young people with arthritis, and we just got funded by the National Institutes of Health in the United States to develop one for sickle cell pain. And all these apps were using the same sort of format to build it. So as I mentioned, most young people with chronic pain don't receive comprehensive sort of education or skills training to promote self-management or how to live well with chronic pain. Again, there's a shortage of dedicated pain treatment facilities. So I don't know if most of you are aware, but in Canada, there's only 10 pediatric chronic pain facilities. And actually in Ontario, the Ministry of Health has infused quite a lot of money over the past 3 to 4 years to improve access for pediatric care and adult care. So we have 2 new centers in Ontario, one at McMaster and one in London, which is great. But again, there are still long wait times, and then the cost of some of these therapies that may not be covered in terms of some of the psychological and physical therapies that might not be covered. So to address this, we wanted to build the app to do this. So this is that integrated app and website to help young people understand their condition, to develop and practice healthy coping strategies, and to receive social support through the app. So these are the features of the app. And again, the first step I should have mentioned was that we actually did qualitative interviews with teens, their parents, healthcare providers, and young adults and their healthcare providers to find out what the struggles they were having and to decide whether an application such as this would meet their needs. And it was unanimous that they thought that this was what should be developed. So that's what led us to this program. And then we had design sessions with the young people to actually come up with the features as well as what would the functionality be. So this is what the website looks like. And so we had, this is Zena, who was a graduate from our pain program, and she was actively involved in the development of some of the content, evaluating it, and she even did some of the videos. And so you can see the website goes over all of the areas that the young people wanted further education and skills training on related to managing their pain. And again, we really believe in our lab that we need to develop these interventions using principles of user-centered design. And this is really all about involving the end users. So this means young people with chronic pain in the development, design, and evaluation of these apps. So as I mentioned, we did do the needs assessment to make sure an app was the right thing to build. We did design sessions where we brought the young people in with our mobile developers to sort of design the wireframes and test sort of the navigation of the app. We did usability testing of the prototype where we brought young people into the lab and had them use the app while we watched them move through it. And made changes based on their feedback, and now we're evaluating it in a pilot randomized controlled trial. to see its effectiveness. So the benefits of using a user-centered design approach are that it can improve the usability of the application. It can improve the user acceptance, so make sure young people really like what we've created and improve their satisfaction. And it can help us ensure that when we implement it, we're not going to run into problems because we know that young people like it and are satisfied with the application. So this is actually the user-centered design session. So these are the mobile app programmers over here. These are some people from the About Kids Health that developed the website, and these are the young people that are living with chronic pain. And so they really helped us figure out what are the key principles for this app, and it was to keep it simple. They wanted help to support them in their regular life and not just be about their pain, and they wanted a friendly and safe place for them to be. And Lynn Cooper, who is the president of the Canadian Pain Coalition, she's been involved in a number of my projects in terms of helping with these design sessions or needs assessments or consensus conferences to build the apps. And this is just a slide from Lynn talking about her experience in being involved in patient engagement research. And she feels it's crucial that we involve people with pain and their caregivers in all aspects of research. It helps these people to be informed and directed. It helps that our questions and results of the apps that we're building are meaningful, and that the outcomes are meaningful and helpful to patients. And that by involving them, we can actually help empower them to be part of the solution by creating a shared sense of purpose, applying their lived experiences and insights into the apps. And that's what we really do in these design sessions. We ask people to talk about what's it like in the day of having chronic pain from the moment you wake up to the moment you go to bed. And that can help us design better solutions. It can help ensure maximum feedback and uptake of the technology, and so the feedback's critical, but also in the dissemination of getting information out to patients and families about these apps that we build. And it really ensures that if we do this in a meaningful way, it ensures that their contributions to our research projects are meaningful to them and to us. So I'm going to turn it over to Katie, but I just want to acknowledge my lab, and especially Chitra, who is the research associate in my lab, who's taken the lead on the project. The app's being developed by the Center for Global E-Health, and the website, Dr. Bruce Dick and Laurie Montgomery were the co-chairs for the development, and the About Kids Health team that developed it. These are the collaborators on this project, and so you can see that these are physicians and psychologists from across Canada at the various pain centers. And then again, just to acknowledge the funding, the needs assessment was supported by the small grant from the Canadian Pain Society. The app, RCT, that we're doing right now was funded by CIHR, and that the Chronic Pain Network, once we finish that pilot study in the new year, they are hoping to fund the full-scale evaluation of this app. So without further ado, I'm just going to turn it over to Katie, and we're just going to switch spots here so she's closer to this mic.
Hi, everyone. Thank you very much to everyone at the Chronic Pain Network for inviting us to speak today and to share a little bit of the work that I'm working on here with Jen as her postdoc, and stuff that I'm really excited about. And I really hope, in the question period or time for discussion at the end, as many of you I know are patient partners or are others working with patient partners, to kind of share your experiences. That would be helpful as well. So our goal, we're lucky enough to get a CIHR patient-oriented research collaboration grant earlier this year, really focused on supporting a patient engagement initiative in pediatric chronic pain across Canada. And so our goal is really to kind of build sustainable patient engagement strategy to facilitate this beyond a particular research project, so that we can really build capacity for patient engagement in pediatric chronic pain research nationally. And we plan to do this in 3 ways, so kind of 3 sub-projects. So one is to create a Canadian patient engagement registry for pediatric chronic pain. The second is to develop patient engagement training materials, specifically kind of for patients and families, as well as specifically for clinicians and researchers. And then the last was to identify the top 10 research priorities in pediatric chronic pain in Canada. So I want to tell you a little bit more about each of these. So just to give you a sense of our project team, so co-leading the project are Jen and myself here in Toronto, and you can also see involved 4 other pediatric chronic pain kind of specialty clinics in Canada across the country. And at each of these sites, you'll see both healthcare providers and researchers, as well as patient partners. So in Halifax, in Ottawa, here in Toronto, in Saskatoon, and in Calgary. And so a number of our patient partners, there's 7 altogether, a number of them are young adults who were formerly kind of pediatric chronic pain patients, as well as a number of family partners, so typically a parent, to really give us a multitude of perspectives. And there's 8 kind of researchers and clinicians, a variety of disciplines. And then we also have a number of other stakeholders. So Dr. Gary Salisbury is with the Ministry of Health and Long-Term Care here in Ontario. So we have some kind of health decision maker, government representation. Maria Hudspeth from Pain BC, Sandy Smink from the ILC Foundation, another kind of patient group, Lynn Cooper, and Dr. Patricia Poulin from the University of Ottawa, who has some experience doing some similar kind of approaches with, many of you would know, with adult chronic pain. So just to give you a sense, as I'm presenting each of this, to return to the IEP2 participation spectrum, I actually see we're touching on pretty much all of these, to be honest, depending on different parts of the project. And just to highlight as I go through, some of that relates to patient partners on the project team itself, who we might be engaging in a variety of ways. Typically kind of in the involve, collaborate kind of spectrum, I would say. But when I talk about the research priority setting, ultimately you'll notice that that is about placing the final decision about what the top 10 priorities are more directly in the hands of patients and clinicians, so and family members, and then really that, where those top 10 priorities are identified and empowering, creating a platform to empower patient partners to do that, then the goal would be that as researchers or as funding organizations that we would be looking to implement what are those identified priorities. So I would say we're kind of moving even in some capacities into that empower space as well. So we're using a collaborative tool to engage together with the patient partners on the team. You'll notice that we cross a number of time zones, which can make it difficult to facilitate kind of real-time conversations. So we're using Basecamp, which I know one of our patient partners, Carley, who's going to talk today too, and who's also involved as a patient partner in the Chronic Pain Network, actually suggested this, and it's working really well for us here as well. So I think really creating some, taking advantage of collaborative tools really helps people to feel engaged and create kind of a community within our team with patient partners. So the Patient Engagement Registry, some of you may be familiar with Alberta. The Sport Support Unit in Alberta actually has a patient engagement registry across health conditions within that province, but we wanted to create one nationally for pediatric chronic pain. And essentially, so often people think about patient registries as patient participants, so where people are providing data that then researchers can use. But what we're really creating here is a platform or an online, I kind of think of it a little bit almost like a dating site, even though it's not quite like that. But basically, it's an online platform where patients and family members who are interested in being partners on a research project, so an equal member of the research team, can get connected with researchers who are looking for patient partners. So as Jen mentioned, oftentimes now this happens a bit informally. If you meet a researcher because they do some work in a clinic, or you kind of really identify and your hospital has some capacity to connect you. There's a lot of kind of informal ways in which patient partners are identified. And the goal of this online patient engagement registry is so that we can kind of facilitate this on a broader level and hope to engage more patient partners with more researchers who may not otherwise be easily kind of engaging or making those relationships. And so the idea would be, as a patient partner, you could create a profile. Researchers would submit kind of potential research or patient partner opportunities for patient engagement. And then as a patient partner, you could reach out to that researcher if it was of interest to you and get connected. So you could even connect across, more geographically too. You're less limited. So the idea behind this as well is that the patient engagement opportunities that would be available or submitted by researchers would cross the spectrum. So some of them may be just for patients to learn or to consult, but some of them would kind of involve and be kind of more collaborative or more empowered patient engagement. So this is, we're using a volunteer software program that's available online. That's obviously secure and private and that kind of thing, but this just gives you a sense of what it looks like very briefly. So the second part of our project is to create some patient engagement training, and we really see this as an add-on. So to already existing things or things that we know, more intensive training that we know is being developed. So we see this as a piece to kind of show or initiate kind of interest and to indicate that this can be something that is feasible, should be happening, people should be aware of kind of in pediatric chronic pain. So we really want to develop and deliver kind of 1 hour, very clinically feasible, pediatric-specific patient engagement training materials for both kinds of those groups, so for patient family members and patient advocacy groups. So that may include things a little bit more about the research process, as well as for clinicians and researchers. And for example, that might include things like, things to think about, like power differentials. How do you create a safe and comfortable kind of equal space for your patient partners, that kind of thing. And I've just put logos for a number of other organizations that we're trying to pull materials from or direct people to for more detailed information. And the last is a national research priority setting. And this follows, we're kind of loosely following a process established by the James Lind Alliance in the UK, which really is about facilitating or directing a top 10 priority process. And they have supported groups to do this across a number of chronic health conditions. You can look on their website. It's a very cool process. And really, it goes through this established process to lead you down to the top 10 research priorities. So we will do an initial national survey to generate what we're calling treatment uncertainties. And these are really questions that any question, concern, or priority that a patient, former pediatric patient, a family member, grandparent, sibling, parent, or other care provider, or clinician who isn't engaging in research, what do they think we don't know about treating pain in kids that we really should be prioritizing? And then we, as researchers, as the research team, will take that and compare that to the existing literature to say, okay, have some of these questions been answered already, but then we need to be better at sharing that information? Or, are these really kind of true things that we don't really know about? And then it goes through an interim priority setting. So with a smaller group, we'll of patients and family members and clinicians, we'll go back to them and they'll kind of wheedle it down to a short list. And then a smaller group of about 10 to 15 people will come for an in-person workshop, and they'll take, and again, the people at this meeting would be patients, family members, clinicians, and they would kind of have discussion and through facilitated activity identify or end up at top 10 research priorities for treating pain in youth. And what's important about this process is that researchers are not part of identifying treatment uncertainties or identifying what should be priorities. So their role, our role really as researchers, is to say, let's compare this to the existing kind of science and identify the gaps that are there. And the other thing that's really important as we kind of involve in patient engagement is that we're evaluating it. So what is it like for patient partners, for researchers and clinicians who are partnering with patients? What is their experience like? Does it map onto some of those priorities or principles of good patient engagement? And how do we improve on this? And then so we're also having everyone on the project team will complete this public and patient engagement evaluation tool developed at McMaster. And then we'll involve patient partners in kind of evaluating what we get from all of our team members there and sharing that information as well, so that hopefully, and through our own kind of process of working on this project as a pretty equal team of patient partners and researchers and clinicians, how do we share our experience to improve that for other people as well. And then we also have some metrics kind of embedded in the online database software where we can look at the uptake of the patient engagement registry. So I'll turn it over to Carly to share her experience.
Okay, great. So thank you so much for inviting me to present with Jen and Katie on the patient engagement panel for today. So I thought I would begin my, I guess, piece of this webinar about my journey and how I guess I've come to be. So I thought that I would first describe just how like my experience, then follow into some of my roles, and then just conclude with some take-home messages from a patient perspective. So I'm a 22-year-old recent grad of nursing from Western University, and I'm just starting out my master's at McMaster University, studying with Dr. Mike McGillian. And, you know, to be honest, when I used to think about what I wanted to do with my life, I never would have thought that I wanted to study pain until I experienced chronic pain myself. And this all started when I was 12. I was in 2 vehicle collisions 4 weeks apart, which subsequently left me living in extreme pain 24/7. Eventually, it took some time, but I was diagnosed with complex regional pain syndrome. And from there, I was then transferred to Fit Kids Chronic Pain Clinic, and that's where I first met Dr. Stinson. So, I mean, over the years, I'd gone for, I don't even know how many, multiple nerve blocks, different procedures. I was constantly in and out of hospitals. And really being in this environment made me consider that nursing seemed to be a pretty great career path, because I liked the idea that you were really, it was a caring profession, and being in the hospital bed for so many years, I understood what that position looked like. So I thought it would be a good career path for me, seeing as I could relate to both being in the hospital bed and then learn how to care for someone in the hospital bed. So at 18, I left Fit Kids, went into adult care, but always kept in touch with Dr. Stinson, kind of let her know what I was up to, and at that point she had suggested going into the Fit Kids Summer Research Program, so I really got to take advantage of seeing what nursing research looked like. So I decided to give it a try and found out I liked it enough to go back for 3 consecutive years. And it was really during that time that I, addressed that I really wanted to be more involved as a patient, and I was really just willing to help in any way I could, because all I wanted to do was really help others who were in pain. So from there, I started becoming a knowledge user and more active on projects where patient perspective was needed. And I think what I loved about working in a pain lab was that I was gaining this awesome knowledge from a different perspective, and I was able to bring my patient experience and nursing experience together in a research environment. And it really led to a lot of self-discovery, and I realized that I had a passion to continue in pain studies in order to help others in pain, because I felt I could relate, and I felt like I could really understand what it's like to live with pain day in and day out. So then, just a couple of years ago, the initial SPORE application was underway, and Dr. Stinson suggested that I participated as a patient knowledge user, and at that time I helped out identifying the priorities that that the SPOR was going to take forward. We ended up doing a video, and we also participated in a town hall meeting where we met with young kids who were living with pain and their parents, and tried to identify some strategies and priorities that they felt were of importance. So then I really just started becoming more active, and coincidentally at that time I was also participating in the Connaught Summer Institute in Pain at U of T, and ended up chatting with Dr. Stevens, really just about life in general and where I was headed. And at that time she brought forward that patient partner was needed for the training and mentoring committee. So just seeing as it aligned with my upcoming goals, it seemed like a good fit. So now I'm finished my undergrad, and I'm a registered nurse. As I said, I just started my master's, and I'm really enjoying being a patient partner in so many different projects and studies, because I'm able to contribute and lend my unique perspective based on my own experiences and how pain really affects me day to day. So I'll go to the next slide. Oops. Sorry. Okay. So that's really how I've come to be, and how I've gotten involved in research as a patient partner. So from the time I was a young pediatric patient to even today, my roles have varied. So I was a knowledge user, and I did work on the I Can Cope project with Dr. Stinson, with Dr. Lulu and Lauren Harris, and they really reached out to me to basically direct any feedback and ask for, how different parts of the project would be received by patients and if it was appropriate for patients. Then, as Katie discussed, my mom and I, we've been on the Building Sustainable Partnerships project, and we've really just started to take off with that project, but both my mom and I are finding it to be really helpful in terms of generating discussion and feeling that we are engaged, and that what we're saying and what we're contributing is really of value, and that it's under consideration. I've also participated in different capacities. So, for example, I was an peer-to-peer mentor, so I was called back as a patient to work with younger patients who are experiencing pain, and it was in a mentorship role there. I've also been on different panels, one of which that sticks out for me. I was only 14 at the time, but it was the Action Ontario, seminar that my mom and I spoke at, and really it was discussing what was important to patients and how our patient experience, was I guess it was just more about our patient experience, but even so, it was the first time where I really felt like I had a whole room of doctors, scientists, nurses, policymakers, and so on, really just taking in what I had to say, believing what I was experiencing, and really just appreciating what I had to offer and my lived experience. So I think ultimately it was the first time that I felt heard, and I think patient engagement really is about being heard as patients. So, and then from there, as we've discussed, I've been active on the SPOR CPN, the Training and Mentoring Committee, and as well as the Paediatric Pain Registry Committee. And really, I think my role on those committees are really to consider how researchers and these committees should be considering patients and should be including patients in their work. And sometimes it's very challenging, and sometimes it's not always appropriate. But I think identifying the barriers in place is the first step in order to work forward to include patients in all parts, as we've discussed so far today. And then there's also been different opportunities. For example, the Canadian Pain Society this year, they had a Patients Included conference where there was actually patient scholarships to attend the conference, and that was something that was really quite novel, because in my young years, I haven't come across many conferences that really encourage participants, patients to be participants in the conference. And really start to question what pain research looks like and, you know, act as a contributing member of an audience. And it was really just a great experience that I really hope other conferences and other seminars and so on, they really uptake this model, because it is incredible to have patients in the same room and really collaborating. And then there's also different opportunities where I've been on grants and lended in my perspective for different projects and upcoming studies and so on. So that's kind of how I've I guess contributed as a patient partner to date, and I'm sure that list will expand as I continue on with my own studies and as I get a little bit older. But I think it is safe to say that as a patient partner, I think it's necessary to really contribute, to really lend your voice, because we are an expert that really researchers, not all researchers have that perspective and can really have that lived experience piece to guide their research. So using us as an expert really, I think, should be taken advantage of. So patient engagement is really all about making sure patients are heard and validating that they are experts. So I figured that it was important to hear from other patients as well. So I reached out to patients, the patient partners for the CPN a little while ago now, and I just asked them what words would they use to describe patient engagement. And really, this was a list that I was able to make. And as you can see, there's a lot of really positive, excited, you know, groundbreaking, proud to be a part of something this novel. It really is important to really just include patients because we are willing to participate. So I think, if anything, this slide is just to show that patients value being heard. They value feeling like they have a seat at the table. But I mean, this slide also shows that there's words that aren't so positive and that there are learning curves. And those learning curves are felt by patients. You know, patient engagement is, you know, it's relatively new, and there's no real beaten path to follow. And, you know, the people who are really trying to initiate patient engagement are really paving the way as they go. So it can also lend itself to be slow, sometimes leading to disconnect and time gaps, you know, like when different logistics are involved. And one of my personal things that I think really needs to be addressed is the fact that, you know, we're talking on a panel that's very welcome to have patients as partners, but there's also researchers that maybe aren't as welcome to have patients. And I think this is something that has to be addressed because it is very frustrating, and it belittles what we can offer as patients. You know, it really is about teaching, you know, senior, mid-career, and up-and-coming professionals that patients are a part of the package, and when it comes to research, should be the standard and expectation when conducting research. And I think that's really why groups like the SPORE Network, they're so important, because getting patients actively involved and feeling like they are important, they have value, and they really can contribute and make a difference. I think it's being of the mindset that patients are experts in their own right, and that as researchers you can learn from what they know inside and out, which is really just, you know, it's living with pain. And I think that is very powerful, that researchers really should harness. So I asked some patient partners to really just describe their experience so far, and this is what the patient partners brought forward. So as you can see, you know, I think patient partners are recognizing that, you know, progress is still slow, but it is of the utmost importance to include patient partners, just because, as I've mentioned, you know, we are experts in that we can contribute, and they can, as researchers, use our skill set to really find success in their research. As I've kind of talked about, by participating as a patient partner, it's giving a voice and really validating that their experience matters, and really with the intent to help others and make a difference. And then it also comes from the perspective, too, that it's not just patient partners, but it's also families as well. And when including patients, it's also very important to consider the people that it directly affects, which includes their families. And I think really identifying those barriers, as mentioned in this quote, that's really one of the key things that researchers have to address moving forward. So I think my take-home message is, as a patient partner, I think patient engagement requires out-of-the-box creativity. It requires a new outlook on how research is conducted. It really takes time to get everyone on board, but it is, we have to start somewhere. And if we don't start, then it'll never happen. So even with the challenges, it's progress. And patients are experts. I think that if anything, it's to use their expertise and capitalize on the lived experience and how that can translate back into research and make a difference. So with that, I'll forward it over to Jen and Katie.
Sure, I'm cognizant of the time and wanting to leave some time for discussion. So maybe I'll just let you everyone kind of take a quick read through the slide or take a look. But we just wanted to reflect some of our lessons learned so far from Jen, myself, and from Carly's perspectives as well.
So thank you, everyone, for the really super presentations. I think that helped everyone really see a number of different perspectives, as you've got on this last slide here, 3 different perspectives and some really concrete examples of your involvement. We do have about 6 minutes left, and we've had some questions come in. So I think it would be great if we could address some of these questions. So the first question, and Isabella, it's coming from you, so I'll ask you to feel free to pipe up if I'm not asking it correctly. But Isabel brings up the point that she thinks that a lot of clinician researchers don't think about when it comes to patient engagement is that caregivers and patients may experience discomfort and sometimes even PTSD when going back to hospitals and medical facilities. And so her question is, I wonder who's excluded by having many engagement opportunities take place in hospital facilities where some of these patients have had treatment or diagnostic paths. So she's wondering for the panel if this is addressed in any way in training for patient engagement in research. So maybe I can start with you, Jen, and ask if this is something that you've come across in training, or if it's at least something you've considered when you've engaged people, their previous experiences in a hospital setting and what this might bring back for them.
Yeah, Isabella, I think that's a great point. And I do have an example that sort of stands out where we've had a young girl who had numerous surgeries and was very traumatized about that and came back to be part of one of our focus groups or consensus group to build a post-operative pain map for young people. And she was, again, reflecting on the experience and was quite overwhelmed, but then actually reflected on how she felt so welcomed by the group. And so creating that environment, even if you do bring them back to the hospital where people are respectful of her past experiences, I think is important. I think Katie had some comments too, but I think it is important to think about that. And not all of these things, whether it's interviews or whatever, have to be conducted at the hospital. So some of the things that we do with the design sessions, we might do at the Center for Global E-Health, which is not sort of at the hospital, which can help with that. But I think Katie had some comments too.
Yeah, I was just going to comment as well. I think it's a really, really good point, and I think it would be fair to say that even sometimes you don't need to be in the hospital setting for that kind of traumatic reaction to even talking about it can take place. And we actually had, on our kind of national project, we actually had another family that was initially involved and was planning to be a patient partner and was part of the grant and the grant application. And then when it came time for us to do the project, it wasn't the right fit for them and their family at that time anymore. And the feedback we got from them was we really appreciate this, but we actually don't want this to be so much of a focus in our life right now, and so we're just going to step back. And I think, you know, how we handled that was really, I mean, you have to take a family's lead or an individual's lead around that. And I think in terms of training for researchers and clinicians, I think that flexibility, one thing, there's lots of things, but one thing I think is the flexibility that an individual's interest or willingness to participate as a patient partner and to what extent can vary enormously. And so you need to be very flexible and respectful of that, and that can change over time. But I think it's a really good point for us to think about, like, how we build that more into, you know, even some of the training materials that we're developing. Like, I'm really hearing you say that and thinking, okay, that's something we really need to make sure we're touching on as well, and looking at what exists out there that talks about that in training. And I haven't seen as much of that, but it's a really, really good point.
My biggest concern is around diversity and getting the same voices over and over again in different, and not just in pain, I'm involved in a variety of engagement opportunities, and almost everything that I see takes place because obviously the clinician and the research partners are in, for the most part, hospital facilities, and so it's convenient to have meetings there. And I wonder who's not even clicking yes to do that initial contact, and how much more diversity we could have in the voices on the patient side if the meetings aren't there. So that's my curiosity.
No, and I think we're trying to build beyond that by through this patient engagement registry as well. Like, can we facilitate a broader range of voices? Can we facilitate, you know, and through our project, because we're crossing so many time zones, we actually don't even have the luxury of having in-person meetings at the hospital, even if we wanted. So we're doing a lot, you know, whether it's over BaseCamp or through kind of virtual meetings, or even just conversations. Like, I've just had brief phone calls with people, you know, at a time that's convenient for them to touch base about things. So yeah, I think it's something we need to be creative and very thoughtful and cognizant about, for sure.
Yeah, thank you.
Thank you.
Okay, we're going to take one more question. I'm going to kind of combine some comments and questions both from Stephanie and Curtis. So, you know, Stephanie speaks a little bit about the fact that, you know, she's been fairly active in helping understand more about her own condition, and by attending forums and conferences and supporting other patients. So she's a bit more of, I'll say, a knowledgeable patient about her own condition. And that kind of builds on, I guess, Curtis's question here, which is, do qualifications, prior knowledge of patients take preference over involving patients that don't have prior knowledge either of their condition, healthcare systems, et cetera, for involvement of knowledge? So kind of a question almost about, I'll say, about bias, about who you involve as patients. So again, I'll put it out there to the panel. In my mind, this is a little bit about what your database, Katie, that you've talked to us about, you building, helps kind of offset, and to Isabel's point, hearing maybe the same voices repeatedly, but I'll let you comment on it as well.
Yeah, I mean, I think that's what we hope, right, is that would be the case, and also that I think that's what we hope through creating some of that initial kind of brief training materials to try to build capacity as well, that maybe some of those people that aren't familiar with, you know, research, or aren't familiar with certain aspects that are important, that they can still speak. And I also think it depends, right? I don't know that you always need to be very knowledgeable about your condition to contribute your voice to lived experience, because that is part of your lived experience, that it may have been challenging to find out, or maybe you're just not the kind of person that likes to consume tons of health information. So I don't think it makes that much of a difference, although it may depend on the project, I guess. Do you want to add anything, Jen? No. I don't know if Carly wants to add anything to that.
No, I agree with everything that's been said, and I think you know, it's making the opportunities really available to patients and trying to find the best ways to get patients involved, right? I think those are some barriers, but I think it's things that have to be worked through as we really learn about patient engagement.
So, Stephanie, I think I heard you pop up.
Yes, I just wanted to say that whatever prior experience I had was really limited to the condition that I was diagnosed with in the past, and that was just the fact that I was curious about what I had, but that beside the fact that it was the quality that I had does not help in what I've been using with the committees that I'm involved with, because it's not knowledge that that is helpful. I'm involved in different projects and research projects where that knowledge is not significant. Do you understand?
Yeah, I think what you're saying is, like, if you have one particular type of chronic pain or chronic health condition and someone who the project is really asking about a slightly different one, exactly. Or a different one completely, that you feel like maybe as your lived experience is different than what might be true for other people with the other conditions. Does that mean, is that
well,
what you're
yes,
saying?
And so it's not necessarily it's not you don't have to have that prior knowledge to be involved.
Mm-hmm.
It's not necessary. You can, as long as you know pain, you can relate.
Yes.
As a patient.
Thank you, Stephanie. There's a very large thread that's happening in the chat right now about involving patients and families and caregivers of lower socioeconomic status and some of the challenges related to seeking out those voices in terms of patient engagement in research, involving them, helping train researchers in that area, as well as clinicians and other patients, etc. So I apologize that we're not going to have a lot of time to talk about that, but I'm going to take that feedback back to the committee, because I think that it could potentially be a very worthwhile topic for us to have a further discussion and potentially a webinar on, to help our network learn how we can potentially better do that. So I want to recognize that I'm seeing all the really important thread grow by, and I'm going to take note of that. I think it would be great if we could put that on our list of future webinars. So I am really cognizant of people's times. We've just been over an hour right now. I'd like to really thank Jen, Katie, and Carly for their time in presenting today, and to all of you who have listened intently, provided some great questions for us to ask, and who are now going gangbusters on the chat. So thanks everyone a lot. Once we have the webinar posted, we'll let you know about the link for it in case you're interested in listening again. And we look forward to having you again join us in future webinars. So thanks again, everyone, and have a great day.